The need for boundaries, both professional and personal, is necessary in every profession. We know you want to be the best healthcare professional that you can be. The following guide will provide you with information and recommendations regarding boundary issues in the practice of physical therapy. We'll discuss best practices, ways to prevent crossing boundaries, and how to best protect yourself against unwanted boundary crossings. We must first remember that physical therapy is a hands-on profession, and arguably one of the most hands-on within the healthcare industry. Physical therapists and physical therapist assistants must foster a trusting relationship with their patients. Great care and consideration must be taken whenever we enter someone else's personal space. Therefore, setting clear and appropriate boundaries helps to maintain professional practice, prevent blurring or crossing boundaries, and protects both the patient and healthcare provider. First, let's introduce some definitions to you. A boundary is a physical or emotional limit that provides for a safe space between the healthcare provider's power and the patient's vulnerability. Boundary blurring is something that occurs when a provider steps outside their normal role and acts in some other capacity. Sexual impropriety is a behavior that may include gestures or verbal comments that are sexually suggestive, disrespectful, or demeaning to the patient. A sexual violation is a physical contact of a sexual nature between a provider and a patient. Sexual assault is the use of force, coercion, or an imbalance of power to make a person engage in a sexual activity without their consent. And lastly is inappropriate patient sexual behavior, sometimes abbreviated as IPSB. This behavior includes any verbal or physical acts of an explicit or perceived sexual nature, such as leering, sexual remarks, deliberate touch, indecent exposure, and sexual assault by the patient and directed towards the healthcare provider. Let's talk about the boundaries within the practice of physical therapy. Blurred boundaries are not just sexual in nature. A blurred boundary can occur when treating family or friends. We know it's not uncommon for family and friends to request your help. After all, they believe that you are the best at what you do. However, it's important to know that there are risks with blurred boundaries. You may suffer a loss of objectivity. By not being able to remove your personal interest in the treatment of a loved one, you may not make the same professional decisions that you would when treating a stranger. When treating people you know personally, you may find yourself making assumptions about their healthcare needs instead of asking the questions you might with a patient referred to you by another healthcare provider. This may lead to your patients feeling uncomfortable answering questions from you honestly due to the personal nature of your relationship outside of the treatment setting. Lastly, you may find your personal relationship suffering if you are unsuccessful in your professional relationship. And while not all boundary crossing is sexual in nature, unfortunately that risk exists. A 2010 study by Cooper, Jones, and Jenkins concluded that many physical therapists exhibit confusion and lack clarity in regards to their views on sexual boundaries within the profession. Many did not know if or even when it was okay to date a former or current patient. This is a big red flag. As we mentioned earlier, physical therapy is very hands-on. Another study from 2015 reinforced that sexuality is an unavoidable aspect of the practice. In order to treat some ailments, patients must allow physical therapists to touch parts of their body that they may not under normal circumstances. To betray this trust is to fail your patient. Now, let's discuss some ways to prevent crossing boundaries with patients. There are a lot of questions you might ask yourself while practicing physical therapy. These questions will help guide your practice and make certain that you are maintaining the integrity of your professional relationship with your patients. Have I set appropriate boundaries from the beginning? Whose needs are being met by the treatment being provided? Do my actions serve the best interest of the patient? Would my actions be documented in the patient record? What would another therapist think about the treatment I'm providing? Do I find myself sharing outside information with my patient, such as intimate details of my private life? If another therapist were treating my patient, would they be taking the same actions? Would my actions confuse my patient regarding my intent? Would the payer agree to the services I am providing? How would I feel about explaining my treatment to the board? The best time to establish clear boundaries is at the time of the first visit. Start by introducing yourself by name and title. This provides your patient with a basis for the nature of your role in their recovery. If it's not necessary for the nature of the treatment you're providing, don't put yourself with a patient behind closed doors. A PTA or a tech can work with you as a team to provide accountability and maintain professionalism. And lastly, limit interactions with your patient outside of the treatment setting. Avoid trading phone numbers or emails. Avoid accepting ad requests on social media platforms. By interacting with your patient on a personal level, you run the risk of blurring your professional boundary. When you're thinking of best practices, remember that education plus autonomy equals informed consent. Educate your patient on the treatment methods you intend to use. A lot of people may not know what dry needling or ASTEM is, but they will feel more comfortable once you explain it to them. By providing your patient with information about their treatment, you then reinforce their autonomy and enable them to make informed decisions about their care. While the physical therapist is the most educated on the recommended treatment method in question, your patient should always have the right to say no. When your patient agrees to treatment, they are giving their informed consent. Informed consent is more than just signing a piece of paper. You should reestablish this informed consent as treatment continues and progresses. You should always record your patient's informed consent in their treatment records. Now, we've discussed ways that a healthcare provider can cross a boundary, and we've given you some recommendations on how to prevent crossing your patient's boundaries. Let's talk a little about what happens when a patient crosses the healthcare provider's boundaries. As we noted earlier during our discussion of definitions, inappropriate patient sexual behavior, or IPSB, is inappropriate behavior of a sexual nature committed by the patient and directed towards the healthcare provider. In 2017, the APCA section on women's health funded a study that found that 84% of the PTs, PTAs, and students surveyed reported experiencing IPSB. 47% reported instances within the previous year alone. The study also found that women are more likely to experience IPSB and also more likely to document such behavior when it occurs. Age and clinical experience plays a factor in whether behavior is directly addressed or ignored. Less experienced practitioners are more likely to use informal methods of handling the behavior, such as ignoring it or laughing it off. More experienced practitioners are more likely to address the patient's behavior directly. Informal methods of addressing IPSB included distracting or redirecting, altering treatment to avoid close contact, avoiding being alone with the patient, speaking directly to the patient, and ignoring the behavior. Formal methods included reporting the behavior within the facility where it occurred and documenting the behavior in the treatment record. There are ways that you can combat IPSB. Assertive responses work best. Try speaking directly to your patient and address the behavior. Set a behavioral contract. Also consider avoiding settings where the patient may feel comfortable engaging in this behavior. Treat your patient in a public area of the facility when possible. Use a chaperone, especially when treating in public area is not a possibility. If you're a supervisor or clinic owner, offer training within the workplace on ways that employees can combat such behavior. Provide support and treat all complaints seriously. Reassign patients when necessary. We know you may be wondering, what has the board done historically regarding boundary complaints? Here are some examples of what sort of behavior the board determined rose to the level of a violation of the Practice Act. Attempting to or actually touching or kissing a patient while at work. Behavior that attempts to engage in sexual conduct with patients outside the clinic. Child pornography charges. And when providing modalities to a sensitive area, not offering to have another individual present in the room. Lack of communication or educating the patient. Not draping appropriately. And lack of education, training, or experience to assess the pelvic floor musculature, even if such assessment is clinically indicated. The board takes all violations of boundaries seriously and expects that all licensees do as well. We hope that this presentation provides you with clear guidelines to steer your practice in the most professional and safe manner. We want to remind you that we all have a responsibility to report violations of the Practice Act. If you are aware of someone who has violated the Practice Act in any way, we encourage you to file a complaint via www.laptboard.org, or contact the board office directly for guidance at 337-262-1043.